Thank you, Madam Chairwoman and Ranking Member. My amendment would extend the Affordable Care Act's premium tax credit to Americans who are caught in the coverage gap, as well as Americans who will lose their Medicaid coverage as a result of this horrible bill. We must extend the premium tax credits for low-income citizens below 138% of the poverty line. I have heard from countless constituents who fall in the coverage gap, and they are desperate to keep their health care. I recently spoke with one of my constituents. Her name is Kiana, and Kiana was caught in the coverage gap. She lost her Medicaid coverage following the end of the COVID public health emergency. When she tried to qualify for Medicaid again, she was told that she made too much money. She made more than the $295 a month to qualify. In my state of Alabama, we have a bare bone Medicaid program. It's so bad that you have to really be P-O. You can't afford the O or the R. So people like Kiana are really scared about this cost shifting. The cost shifting will mean that Medicaid will not happen in the state of Alabama. The fact of the matter is they're not going to pay for it. They're just simply not going to pay for it. Madam Chair, I firmly oppose this so-called big, beautiful bill that has come to us from the Senate. Let me be clear, there's nothing beautiful about stripping health care from working families. There's nothing beautiful about taking food off the table of our most vulnerable neighbors. And there is certainly nothing beautiful about putting rural hospitals on life support. Madam Chair, this bill will gut Medicaid as we know it. It will slash funding for millions of children, seniors, veterans, and people with disabilities. Medicaid is a lifeline. It is a bill. This bill will cause 17 million Americans, including 170,000 Alabamians, to lose their health care. And it doesn't stop there. This bill will also gut SNAP benefits, a program that puts food on the table for hardworking families, for children who need breakfast before school, for seniors who are choosing between groceries and their medicine. In Alabama, it means 750,000 Alabamians could lose their nutrition benefits or worse, see them reduced. The cuts in this bill are not just numbers on a page. They are empty cupboards and shuttered clinics. There are hospital wings closed in small towns already struggling to keep their doors open. They are parents lying awake at night wondering how they're going to be able to afford medicine for a sick kid. We should be strengthening the safety net, not shredding it. We should be investing in the health care and well-being of our most precious commodity, our people, not ripping it away from them in order to pay tax cuts for billionaires. This bill is not a blueprint for prosperity. It is a roadmap for further inequality, for deeper poverty, for rural communities left to fend for themselves while the powerful walk away with more. Madam Chair, we were sent here to stand up for those people, not to abandon them. Let us stand together and reject this careless, heartless bill. Let us build something truly beautiful, an America where health care is a right, not a privilege for the few. A right. No child goes hungry and no community is left behind simply because of their zip code. I oppose this horrible bill, and I ask that my amendment, which will make it a little bit better, is considered by all. Thanks. I yield back the balance of my time.